mynews.studio.
Imagine a single injection, just twice a year, potentially transforming how we approach HIV prevention. How close are we to seeing that become standard everywhere?
Today's date is July 29th, 2025. The World Health Organization just came out in support of injectable lenacapavir for HIV prevention, right?
That's right, and it's a significant development. For the first time, WHO is recommending a twice-yearly injection as a frontline HIV prevention tool. The timing is important. Global progress on HIV prevention has stalled, and we saw 1.3 million new infections last year, mostly among communities that are already underserved.
Why lenacapavir, though? What actually makes it different from the daily PrEP pills we've had until now?
The key difference is how it's given and the level of protection. Lenacapavir requires only 2 injections a year instead of a daily pill. In clinical trials, Purpose 1 and 2, the findings were striking. For cisgender women, there were 0 HIV infections. In another group, the protection rate was 99.9%.
So that's not just higher effectiveness, but it also makes things simpler for people. Does that mean the biggest challenge with PrEP right now is just sticking to a daily routine?
Exactly. Daily pills are effective, but a lot gets in the way. Stigma, forgetting doses, or having trouble getting the medication. Taking a shot every 6 months removes a lot of those obstacles. But it does bring up a new challenge. When will people in lower-income countries be able to get it?
How does the approval process actually work in those settings? Is it just about waiting for each country to sign off?
It's not that straightforward. Some countries look to agencies like the FDA or WHO for guidance, which can make things faster. But others need local trial data or their own reviews for cost effectiveness. Then there are practical issues. Can their health systems store and deliver an injectable like this?
So even with WHO's endorsement, there's still a gap before people actually get access. What could help close that gap? International donors, maybe?
Yes, donor funding can help, and so can streamlined regulatory processes or organizations like Medicines for All. Still, limited resources and infrastructure slow things down. WHO support is a strong push, but rollout depends on much more than just scientific approval.
Let's talk about those rollout hurdles. Even if countries approve it, what about cost and actually getting it to the people who need it? Are health systems ready for that?
Cost is a big concern. If funding falls short, it limits how widely the injection can be used. Supply chains will have to adapt to store and distribute it. And then there's stigma. Some people might avoid clinics because of fear or judgment.
Are there ways around that? Maybe by bringing prevention closer to communities.
Yes, that's actually part of WHO's advice. Make HIV testing simpler and allow pharmacies, mobile clinics, even telehealth to deliver the injection. This means people wouldn't have to go to a special clinic, making it more private and accessible.
How does this new injectable fit in with existing prevention choices? Will people still have options? Or is this meant to replace daily pills?
People will still have choices. WHO now recommends lenacapavir as another option alongside oral PrEP and other injectables like cabotegravir. The focus is on expanding choices so people can pick what works best for them. It's about patient-centered care and making it easy to switch if their needs change.
So the significance here is scientific and social. It's a new tool that could cut infections sharply, but only if countries can move quickly on approval, funding, and delivery.
Right, and if we can bring it into community settings, we might finally reach more people, especially those who haven't benefited from existing methods.
That's the big challenge. Can global systems move fast enough to turn this scientific advance into real-world impact?
Exactly. Science has brought us here, but now it's a matter of policy and funding keeping up.
We've covered the breakthrough, the obstacles, and what's on the horizon.
Thanks for joining us as we explored the potential and the hurdles of injectable HIV prevention.
Thank you for listening. This episode was brought to you by mynews.studio. Try it now for free.